Well, in the traumatic stress field, interventions have been considered early when treatment is initiated within 3 months after a traumatic event occurred. These early interventions aim to treat symptoms associated with PTSD and to prevent the development of PTSD and other comorbid disorders. However, the main treatment guidelines vary widely in their definition of early intervention and also in their recommendation of EMDR therapy as an early intervention. For example, the International Society for Traumatic Stress Studies guidelines published in 2019 consider early interventions treatment provided within the first 3 months, but made a distinction between single-session interventions and multiple-session interventions. These guidelines gave a strong recommendation for multiple-session EMDR interventions for adults during the first 3 months after experiencing trauma. They also recognize an EMDR single-session intervention as having emerging evidence. However, on the other hand, the National Institute for Clinical Excellence, NICE guidelines published in 2018 consider early interventions over 2 time periods. Intervention within the first month, which were labeled as prevention, and PTSD treatment during the following 2 months. Of all available EMDR early intervention randomized controlled trials at that time, 2018, only 2 were identified by NICE. Therefore, they did not recommend EMDR early intervention for prevention in the first month and only recommended considering EMDR therapy for non-military trauma during months 2 or 3 if the client requests EMDR. About the WHO guidelines published in 2013 and in accordance with the DSM-5, at that time they considered early intervention as the one given during the first month post-trauma. At that time, only one EMDR randomized controlled trial was available. Therefore, the WHO did not recommend EMDR for early intervention. We have 8 randomized controlled trials, 4 cohort controlled studies, 11 case studies, and 16 non-randomized controlled trials. Of these 16, 2 were non-randomized controlled studies, 2 were non-randomized historical controls, and 12 were case series or uncontrolled studies. It is important to mention that in terms of level of evidence based on SACET criteria, the strength of the research evidence for EMDR therapy as an early intervention is strong enough to be rated at level 1. In addition to significant reduction of PTSD symptoms that were maintained at follow-up, overall, the studies provide support for the notion that early EMDR therapy intervention may also be effective in ameliorating symptoms of depression or anxiety. Yes, the result of the EMDR early intervention research suggests that EMDR therapy is effective in reducing PTSD symptoms and that it was more effective than either waiting lists or treatment as usual control conditions, supportive counseling, and critical incident stress debriefing. New research on EMDR therapy for early intervention has been carried out. For example, From 2020 to 2022 were published studies on the provision of EMDR therapy early intervention in group format, online and also in person, to treat healthcare workers working in hospitals or in residential nursing homes during the COVID-19 pandemic in Latin America and Europe. All the studies show a significant decrease in PTSD symptoms. Based on the knowledge of the criteria used by the different guideline committees, in the future and for a wider inclusion of EMDR therapy in the clinical practice guidelines as an early intervention, all new studies need to be high quality, multi-site, randomized controlled trials with larger sample sizes of at least 10 participants on each arm of the trial at every time point, with children and adolescents, with group interventions, and conducted within 3 months post-trauma. There is also a need for studies that treat trauma symptoms within 1 month and with a single session treatment, and also to evaluate the prevention of PTSD with clinical administered diagnosis measures such as the CAPS-5, administered to treat and not treated individuals. Other areas of interest are investigating the effect EMDR early intervention may have on preventing other disorders and on increasing resilience.